Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Looking for more from Boise State Public Radio? Follow us on Instagram. You'll find behind-the-scenes peeks at our station, quick updates on the stories shaping Idaho, and reels that bring our reporting to life. It's a new way to connect with the music, news, and voices you hear every day on the air. Search for Boise State Public Radio on Instagram and join our community.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Health officials in California are investigating 3 cases of mpox, none of them related. And what's worrying medical experts is that this strain appears to be more serious. And if it is spreading locally in Southern California, it could show up in other states as well. Dr. David Pate is joining us today. He is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, to talk to us more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email at idahomatters@boisestate.edu. Okay, so Dr. Pate, remind us what mpox is.
Yeah, so this is a virus that when it infects people, the most notable distinguishing feature of it is the rash with the pox-like lesions. And there are 2 different, what we call clades, which listeners can think about like species. There's a clade 1 and a clade 2. And for your long-term listeners, they will remember that in the summer of 22, you and I discussed the fact that what had previously been a disease pretty much confined to Africa was now spreading across the world, and that the United States had about the second largest number of cases, but that was clade 2. And that seemed very closely to spread among predominantly males, particularly gay males or males that had multiple partners. And clade 2 is the milder form. Now what we are seeing is the clade 1, as you mentioned, and we've got these 3 cases identified in California. Of note, all 3 had to be hospitalized because this clade 1 does make you much sicker. And in Africa, the same may not be true here, but in Africa, it had about 10 times the mortality rate of clade 2. So while we saw very few deaths with clade 2 and very few people needing hospitalization, that could be quite different if this takes off. And I am not convinced, although the CDC is currently saying that the risk factors for clade 1 are the same, I'm not convinced that is true because we did see different epidemiology in the outbreaks in Africa.
So with that said, Dr. Pate, with this being the clade 1 potentially, how do we know how that is spread? I mean, is it spread the same way as clade 2?
I would say that I don't know for sure. The CDC is saying it's the same, and that certainly could be true. But we did get surprised with monkeypox before, and that's why I'm reluctant to just assume that we know. But generally, it's thought that you have to come into close contact with somebody with this form of monkeypox. The CDC is suggesting that it would largely be through sexual contact. However, certainly in Africa, we saw a lot of household spread and other things. So, but I do think that this is something that is certainly quite different than COVID, influenza. I don't think we're going to be seeing this spread in schools like we see those two. I don't think we're going to see it spread across distances. Most likely, you're going to have to come into close proximity to somebody with this disease. And but certainly we'll learn more with time.
So, Dr. Pate, these three cases are what medical experts, or at least what I've read, is that the cases are not related and that no one had traveled recently. So, this has the ability to be spreading locally. Can you explain what all of that means?
Absolutely. So, what would be reassuring to us is if these folks had traveled to Africa, where to the specific countries where we know that monkeypox is currently spreading, and that they then returned. It has a very long incubation period, so that they may have been exposed there in Africa, returned to California, and then manifested the illness. That would be reassuring because it would be highly likely that they contracted it through a contact in Africa. However, the problem is these three individuals are reported not to have had any travel out of the area in the time frame that would have put them at risk for this. So that suggests that somebody locally there transmitted it. What would be next most reassuring is if they were not the ones that traveled, but somebody in their close network or family had traveled, but they didn't detect that either. Therefore, and these three separate cases, two of them are in, two of them are in one county, one is in another county. And these three people did not come into contact with each other through any kind of relationship. Therefore, what we conclude is this is the worst case, which means it must be spreading in the community, and they were exposed. We don't know from who, which probably is support for my caution of not presuming that we know how this is spread, because I think they would have detected where they caught it if that was the case. But they don't know where they were exposed, and they don't believe they were exposed by leaving California or interacting with each other. Therefore, there must be transmission within the community, and what we call that is community spread. That would mean that other people may unknowingly be at risk for exposures. And so we have to monitor, we have to put doctors on alert, make sure they're looking for this particular manifestation, make sure we identify cases and see if this continues to spread or show up in other places.
Okay, so Dr. Pate, what does all of this mean, for folks who aren't living in Southern California? But even a lot of people who live in Idaho, they travel down there, right? So what does all of this mean?
At this point, it would be very low risk. So I don't think that anybody in Idaho needs to worry. I think doctors and emergency rooms and clinics in Idaho should be alerted and just be on the lookout in case cases do spread here. Someone from California could easily travel here, or it may be in other places as well. So we just need to be on the lookout. However, if I were traveling to California, I would not be taking any additional precautions, and I don't think anybody else needs to. If people are in high risk groups, as the CDC has identified, and that being at this point, people particularly that might live in those communities and have multiple sexual partners, until we establish exactly how this is being transmitted, those people might want to get the Jynneos vaccine. It's the mpox vaccine. And there's probably not going to be many places other than their public health departments that have that vaccine, but they could check with their public health departments, and we can certainly make that vaccine available to them. And I know the state of California has already said they will be offering the vaccine. It's a 2-dose vaccine. You have to get the doses a month apart, and it's given in the back of your arm. So if people feel like either they're high risk because of the multiple sexual partners, or maybe they do end up maybe being friends or contacts of the people that have been identified with monkeypox, or feel that they have some other exposure, then they should be contacting their public health department to get vaccinated. Even once somebody's been exposed, we still have 2 weeks that we can vaccinate them, because this virus has such a long incubation period. But Idahoans don't need to take any measures at this point. You and I, of course, will be monitoring this situation. If we see that the outbreak's getting bigger and spreading to other areas, of course, we'll warn your listeners. But at this point, it's very low risk.
So I want to turn now to another concerning disease. The first case, I believe, in more than 6 years, I think I'm saying this right, of chikungunya virus has been reported in New York. So Dr. Pate, refresh our memories on this virus.
Yes, this is another one that I don't think Idahoans need to worry about, but I do think the medical community needs to be on alert. Of course, we're getting towards the end of the season where mosquitoes are proliferating, and certainly once we get our first freeze, that will die off many of the mosquitoes. But this is another virus transmitted by mosquitoes, and it was first recognized in an African country where people spoke the Makandi language, and so they named it chikungunya. That's why it has such an unusual name. And what that translates to is it translates to that which bends up, or one who bends over. And the reference is that if you are bitten by one of these mosquitoes that has the chikungunya virus, that virus typically causes fever and very intense joint pains. And that usually starts about 3 to 7 days after the bite. But certainly some people do get worse symptoms. They can get headache, they can get muscle aches, and some people will get joint swelling, and some people will get a rash. In most cases, this will clear up within about a week, but a week of misery. It is really not fun. You don't want this. And unfortunately, there are some people that do go on to continue to have joint pains or even some disability from it for weeks to months afterwards. So it can give a lasting effect. The people that are at greatest risk for this are newborns, as well as older adults, and people that have underlying high blood pressure, diabetes, or heart disease. So for people in New York, in the Northeast, the recommendation would be the same as for other mosquito-borne diseases. If you're going to have uncovered skin, particularly be out in the early morning hours, in the late evening, then you want to have used a DEET spray or some kind of effective mosquito spray, or wear long sleeves, long pants, have your pant legs tucked into your socks, those kind of things. And if you're sleeping outside, make sure you've got mosquito netting. But the biggest point about why this is significant is that, as you mentioned, we haven't had a case of this in the United States since 2019. And before that, we hadn't had it and I believe it was 2014. And to my recollection, that was the very first time we got it. This is a disease that typically occurs in the tropical areas of the world. The thought is that because of global warming, the mosquitoes that carry this virus have moved further north. And what this means is because it's spread by the same kind of mosquito that can also spread some other nasty viruses that we don't generally deal with, but cause very bad problems, particularly the Zika virus, which we have had enter into the United States in the past, and the dengue virus that we've talked a little bit before. One of my friends who is a specialist in tropical diseases is actually worried that this may be the bellwether for eventually yellow fever returning. And probably none of your listeners will remember yellow fever, but having lived in Texas, I remember when yellow fever just about wiped out Galveston, and it was a very terrible disease. I hope he's mistaken. However, he usually turns out to be right. So basically, we're going to have to get a lot more serious about mosquito transmitted diseases. But unfortunately, I think this is a time where that kind of expertise to deal with these kinds of diseases that have not been problems in the United States for, I mean, really since the 80s, those people are gone by and large through the layoffs, the reductions in force. We're just not very well prepared, and that may be a problem.
Okay, I just read your most recent blog post the other day, and I'm very curious about this and want to talk about it. And your headline was how getting vaccinated can keep you from losing your mind. And what you're talking about is things like dementia. So can you talk to us first about the growing evidence when we are looking at healthy aging and how apparently inflammation plays a part in this?
Yeah, this is something that, of course, those that are peddling vaccine disinformation, they'll never mention this. And most of the discussion about vaccine preventable diseases gets centered around, well, are people going to die from the disease? But as you and I have talked about many times over the last 5 years, you have to look at more than just whether you're going to die or not. So many people think, oh, well, it's actually better to have natural immunity and get infected. That is almost never true. In fact, I can hardly think of an instance where that is true, because not only does the disease get very severe in people, we are learning more and more about long-term implications of infection. And so I felt compelled to write this blog. Over the past few years, we've been accumulating data that there are 4 vaccines, and my guess is that we'll find more, but 4 vaccines that will reduce your chances of developing dementia, in some cases, even things like Parkinson's disease, Alzheimer's disease. So influenza vaccine, and that is timely. We are approaching the flu season. I have heard people tell me, oh, I don't get the flu vaccine because, it's just a cold. Well, no, it's more than a cold. And some people will tell me, well, I don't get the flu vaccine because I took the vaccine 1 year and I still got the flu. Well, that can happen, especially if you get the vaccine too early. But in fact, what they were able to show is those people that get severe influenza with pneumonia, they have increased risk for Alzheimer's, Parkinson's disease, amyotrophic lateral sclerosis, or what we call Lou Gehrig's disease, and dementia. And that lasts for at least 15 years. When they give the vaccine to those over 65, so they give them the flu vaccine, that decreases their risk for Alzheimer's disease by 40%. For adults in general that take the flu vaccine, I've taken the flu vaccine every year since I was age 24. The risk for Alzheimer's disease drops 21%, and the risk for vascular dementia reduces 42%. RSV You and I talked about that, and that vaccine actually just got approved in the last 2 years, and already what we've seen is that even over 18 months after getting that vaccine for adults over 65, their rate of dementia reduced for the next 18 months, and it was even more than for getting the influenza vaccine. The third vaccine is the shingles vaccine. They have found a 20% drop in the risk for dementia over the next 7 years, and the benefit was even greater in women. And then finally, the Tdap, the tetanus, diphtheria, and pertussis. We've talked about whooping cough. If you
Hmm.
get just the Tdap vaccine, it reduces your risk 18%. If you get just the shingles vaccine, it reduces it 25%. If you get both vaccines together, they saw a reduction of 42 to 50%. So I think the point is exactly what you said earlier, because not all of these are diseases that are prevented by the vaccine that necessarily infect the brain directly, but we think that neuroinflammation is a big deal in terms of whether you develop these problems, and virus infections of many kinds, even if it doesn't directly infect the brain, we believe can create this inflammatory state that does pass on to the brain and may put you at greater risk.
It's really fascinating, Dr. Pate. I mean, this idea too. I mean, because we're starting to hear more about inflammation, right? And now we're seeing actual medical science coming out about this and how important it is to keep inflammation down in our bodies.
You are exactly right. And we actually have learned a lot because of all the intensive research about COVID. And of course,
Mm,
you'll recall me mentioning to your listeners that after COVID, you were at higher risk for cardiac events and
mhm.
stroke. For at least a year. And we believe that that is because in those folks, they got some ongoing inflammation. We now know that, in fact, heart attacks are generally a condition of inflammation in those arteries. And in fact, just recently, one study has identified some bacteria that is commonly in your mouth that can be in these plaques that may be playing a role in that. So we're learning tons. And unfortunately, it's at a time when the disinformation is being spread. Oh, you're going to, these vaccines will cause cancer, which is baloney.
Mhm.
They're going to, all kinds of horrible things. But in fact, what we're learning is no, there's even benefits beyond necessarily just preventing you from getting that disease. The latest is that we're still looking at is that actually there are some cases where these vaccines may be helpful in either delaying the onset or helping in treating cancer. So the opposite may be true. We don't have enough evidence for me now to make that claim, but I'm telling you that we're
Mhm.
starting to see this kind of evidence. I think over the next few years, Gemma, we'll be talking more and more about these surprising benefits from getting the vaccines.
Okay, so with that said, you mentioned the influenza vaccine as being one that could help with healthy aging. So we've had people wondering, is it time yet to get your flu shot? And of course, I think since August, I think my pharmacy has been recommending to get it. So, Dr. Pate, where first off, where are we in terms of influenza here in our area?
So we have very low levels. Now, keep in mind, we have very low levels throughout the year. People think of it just being in the season. It is possible to get it throughout the year. We don't see much of that, but it is still very low. We have not officially begun this flu season yet. So if you are trying to time the vaccine, and I'll remind your listeners why you might want to do that, then it is a little bit early. If you are somebody that you really need to cross this off your list, you just want to get it done with, then pick a time next week, go get your flu vaccine, and I think you'll be in good shape. But if you're willing to hang in there with us, I think we can better time it. Why would you want to time it? Well, if you look at the blog post before the one that you just covered with me about the benefit of vaccines for dementia, I lay out clearly how it is that I time the vaccines and why I time them. And so basically, here's what the deal is. If the typical flu season that we're going to deal with is about 4 months long. And on average, there's a lot of variation. It will start around the second or third week of November. That's why I say if you just want to get it over with, go get vaccinated next week. Now, typically the peak occurs around the second week of January, but that could be as late as March before we see the peak. And then typically the flu season ends about the third week of March, but we've seen it end as late as the second week of April. So what I'm trying to do is, because we know the protection does wane gradually from the vaccine, I want you to have the vaccine in time to be protected, but I want it to last. And so, like you said, when the pharmacies, it makes me cringe, they start pushing their flu shots in July or August. If you get it then, you are not going to be protected for when we see peak activity of flu. That's why I don't like that. And so basically, these vaccines, if you get it, thinking it has to last for 4 months. Basically, the first month you're going to be about 60% protected in a good year. And it looks from the data in Australia like this is going to be a good year, a good match. So you have about 60% protection. Now, that's from infection. So it's even higher for severe disease. But by that fourth month, with the waning, I did the math, and you would end up with about 45% protection. Still great, but not as good. That's why I suggest for those that are willing to time it, let's time it. It looks like the flu season is going to be bad. People will remember that last year was the worst we'd had since the last pandemic for the number of kids who died from influenza. I've just seen the preliminary results from Australia, because remember, they have their flu season before we have ours. They had higher rates of hospitalization among those that got infected with flu this year than last year, and last year was a bad year. So I think we're going to have a rough year. I think if you'll hang in there with me, I'll tell you when to go. It will not be too long, but we can time this better. But if you're just anxious to get it done, go next week.
Okay, but if not, wait, and you will definitely let us know.
We'll cover it every week if you want, Gemma, and then we can let them know when to go.
Yeah, I think we should probably start doing that. So hang with us, folks. I know my kids are waiting with bated breath until I tell them they have to go get it. But I always appreciate your advice, Dr. Payton. I know so many of our listeners do as well. So, of course, stay with us.
And it's a good point.
Dr.
Get your kids. Yep, get your kids vaccinated too. Kids spread this.
Yeah, they do, honestly. So as always, Dr. Pate, thank you so much. Folks, if you have public health questions for Dr. Pate, of course, he's going to be back next Wednesday. So send us an email, idahomatters@boisestate.edu. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.